Hi there. I just want to say a few words to everyone who, like me, has been trying to sort through all the confusing and sometimes contradictory information out there about the coronavirus and how we can protect ourselves, our friends, our family, our loved ones, and at the same time try to do what we can as a community to contain the epidemic. First of all, I just want to say I'm not an expert, but I've been listening to the experts and I've pulled together information that I think could be helpful, and I want to share very, very helpful an important health tip with this video, and I will also be sharing some important health tips for boosting the immune system in a follow-up video. So, that being said, first off, I guess one thing I think is helpful and useful in all this is to look at the difference in how the epidemic has progressed in Italy and South Korea. Um, in particular in the mortality or death rate. In South Korea, the mortality rate is 0.01%. In Italy, it is almost 10%. So that is a staggering 100 times higher in Italy. So that difference is absolutely mind-boggling, and people are trying to figure out why that is. Well, part of the evidence suggests that a big part of it may be because of the population groups that are sick in each country. In South Korea, one of the largest group are young females, so relatively healthy, non-smoking, etc. While in Italy, probably the largest population group are seniors, older white males, many of whom smoke. So that goes a certain ways to explaining the difference in those mortality rates, but maybe not all the way, because when we dig a little deeper, we discover a couple other facts that help illuminate the vast gap in those mortality rates. For instance, when news first spread from China about the virus, South Korea implemented widespread testing, and they made tests readily available. While in Italy, testing lagged far behind and is just beginning to catch up now. So why are the tests so important? Well, first of all, people who test positive are immediately quarantined, so they're not out there to spread the virus. Secondly, if somebody was tested and they tested positive and they were a severe case, they would get treatment sooner, aggressive treatment, and thus have a better expectation of survival. But there's another reason, and that is a reason we don't often talk about or look at, and that is that in Asia, since these coronaviruses first started showing up, a lot of people wear masks, particularly when a new virus comes out. Now, do masks protect a person 100%? No. But even if they protect 50% or 60%, that's a vast and a big, big important difference. The masks that the N95 and N99 masks claim, as the numbers indicate, to filter out 95 to 99% of particulate matter, which could be airborne transmission of disease. But again, even if it was a much lower number, 50 or 60%, that's a vast difference in your protection rate when wearing one between not wearing one. Now, why is all this important? Well, in the West, our governments have been encouraging us to do social distancing and several feet away from people. But the problem is we all have to go into the store sooner or later to get food and supplies. And once we're in the store, we can't always keep 3 or 4 or 6 feet away from people. Plus, we're passing people in the aisles in the store. Same thing if we're living in an apartment building. We're passing people in the halls. We're with people in the elevators. And I know many people are under the impression that we'll only get sick if someone infected sneezes or coughs around us, but that's just not true. A study done at the University of Maryland in January 2018 proved that people with viruses like the flu, which the coronavirus mimics, can generate and do generate infectious aerosols or tiny droplets even when they're not coughing. So a virus can be spread just by breathing. It doesn't have to be someone standing in front of you. It doesn't even have to be someone there. You could go in an elevator after someone has been in there. If they have the virus, if they are breathing into the air and you come in right after, it could be there as well. So given all that, why don't we wear face masks? Well, again, one of the things the government's been doing is discouraging us to wear them unless we're already sick, telling us they don't protect us. But in the next breath, they say they also need to protect their supply, so they have them for the health workers for their protection. So I'm not sure what gives. I mean, you make from that statement, you almost wonder if they're masks or smart masks that are only supposed to work or know they're only supposed to work if you're a healthcare worker, which of course isn't the case. And I get why the government's doing this, and we all want to protect frontline healthcare workers who are risking their lives to help us. But wouldn't the answer be to produce more masks rather than to put the rest of the population at risk? Because obviously masks help. Not 100%, but wouldn't you be happier with a 50% reduced risk of getting sick? Because a lot of people are going to get sick. The latest estimates in the US is that up to 96 million people are going to get the virus. Why? Because it communicates and affects like a common cold or the flu. And if you think about it, how many of us go through cold and flu season without getting sick at least once? The only difference is now that the odds of dying from a cold or flu is minuscule, while with COVID-19 they can be up to 10%, as we know from Italy. Now, if you're young and they're telling you it's not deadly for you, you might not want to worry about it or protect yourself. But if you get sick, you're spreading it to everyone else you meet. And more young people are getting sick and actually getting hospitalized as new evidence comes out and the virus mutates. But there's another reason we don't wear health masks here and in the West, because we just don't think they're cool. For years we've been mocking people coming out of Asia wearing them. True. And but maybe now we're finding out they knew something that we didn't. Now, none of this is to suggest that we shouldn't practice social distancing or washing your hands. Those steps are essential parts of containing the epidemic. And there's evidence to show the virus can live on surfaces, whether organic or inorganic, metal particularly, or flesh for several hours or maybe even days. But relying on those things alone seems a little bit like trying to dodge a bull in a bullfight ring. In fact, it's a hell of a lot more dangerous. Only a couple of matadors have died bullfighting in the last couple decades. And only about 1% of the people who run with the bulls at the yearly festival in Pamplona actually even get gored. But the odds of catching a cold or flu in the winter are at least 20% and perhaps up to 50%. But that's basically what they're telling us to do, to try and not catch a cold or the flu in winter, because this one could kill us. So given that, shouldn't we all take all the precautions we can? As I said, I'm going to talk about some great supplements that can be taken in my next video, again to help the immune system. But on the subject of masks, I guess my question is, if we refuse to wear them or take the measures that the South Koreans did, aren't we just being coronavirus matadors? So I don't know about you, but I'm going to wear a mask when I go out of the house. Olé!